The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Hi, Shifties. Welcome back to the next episode of the Shift podcast. I'm Dr. Andrea Coyle, the chief shifty, if you will. And this is such an incredible, exciting month. It's the month for nurses. And what we decided to do at SE Healthcare is to continue our great partnership with the Daisy Foundation. And we're talking this month with many, many folks that have been partners with the Daisy, because truly no one does meaningful recognition better than Mark, Bonnie, Melissa, Tina, Deb, and the whole team over the Daisy Foundation, including all their partners across the globe, including their board of directors. And so with me is a huge Daisy partner, huge Daisy advocate, and huge nursing advocate, Melissa Fitzpatrick. Welcome to The Shift.
Thanks so much for having me. I'm thrilled to be here. Happy Nurses Month, everybody.
That's right. It's such an exciting month, Melissa. And, you know, let's just get started. Let's just get down to it. Tell the shifties some of the shifts in your career, whether personal or professional, that have made an impact and have really elevated the profession of nursing.
Thank you. Well, hello, shifties. It's a pleasure to be here with you. Gosh, I've been a nurse this May. Right now, it's 48 years in nursing. And I started as a critical care nurse, that young whippersnapper, 19-year-old running an ICU in Center City, Philadelphia back in the day. Was too innocent, too unknowing to really know what I had gotten myself into. But I prided myself on being an excellent critical care nurse. I feel like I had a huge impact as someone who laid hands on others in their most vulnerable times of their lives. I always treated every patient as if they were my own family, my own loved ones. That's how I was raised by the Mercy nuns at Gwynedd Mercy University, and carried that Mercy tradition forward. And then as I got more experience, I got more involved in association work through the American Association of Critical Care Nursing. And then that opened up every door I could have ever imagined. I was chosen to be on the board, elected to be on the board of AACN. I served as national president of AACN. And that just opened up so many avenues to network, to meet people all over the world, to really focus in on how to advocate for patients and families, and to build this critical care community over many, many decades. So started clinically, and then got more and more involved in association work. At the same time, my day job was moving in a direction I had not anticipated. I got into a nurse manager role. Then I was a clinical nurse specialist. And next thing you know, I got into executive leadership roles, all in critical care to start with, and then got recruited to be the chief nurse executive at Duke. So I would have never predicted that path. It's not something I had ever envisioned for myself. I loved direct patient care and knew I was making a difference every day. But then found that in each of those other roles, I was able to have a different viewpoint, maybe apply my skills and my leadership by casting a wider net. I had, 5,000 or so nurses and providers that worked with me at Duke at the time, and just was able to advocate in a new way at different tables. And as that whole evolution took place, unbeknownst to me, I got recruited into some of the industry partnership roles that I created. I was the first ever chief clinical officer for Hillrom, and really helped evolve that organization from the bed company to partners in patient safety and clinical quality. So really trying to advocate at the point of care by bringing offerings, equipment, offerings, patient safety to a higher realm. So I've really seen my career shift, honestly, from the bedside through executive roles in hospitals and systems into industry. Now I'm doing quite a bit of work in board service. I'm on the board at UNC Rex Healthcare here in North Carolina, where I live. And again, advocating at a different level. I'm serving on my Gwynedd Mercy University board, so really trying to advocate for higher education, trying to get the next generation of providers through our system and out into the field. So
Melissa,
yeah.
I'm going to ask a question because you've said so many things that um, along your journey, did you ever have or have you had anyone that you want to meaningfully recognize right now? Did you have that person when you were that ICU nurse that said, I see something within you, Melissa. I see this potential. I see this leadership skill. Do you have those people in your life that you can shout out to now if you want to?
Yes.
And and B, how important is that as nurses, is that we continue to find those strengths and opportunities in others?
Well, I love that you asked that question because somebody that I have spoken about all over the world, somebody that I have written about, was my original mentor in nursing. Carol Hudemeyer was my chief nurse at Graduate Hospital in Center City, Philadelphia. And I was pretty brazen. I was Missy from Delco at the time. And so I
Wait,
went into
time
her
out.
office.
Hold on, Melissa. This is where it gets crazy. I was an ICU nurse. My
Yes,
real name is Andrea, my birth name.
yes.
But because I was a whippersnapper, my nickname is also Missy. So we have all these things in common. And
And you sound like you're from Pittsburgh. And
exactly.
I'm from Philadelphia. So
Uh,
there you go.
I
Well,
can't be excited for the Eagles. I'm sorry.
we don't have to go there.
Okay.
I walked into Carol Huddemeyer's office when I was about to finish my master's degree and said that I wanted to teach critical care for her. I wanted to start a critical care course. I wanted to do this and that. And she said, okay, write it up and let's try it. If it doesn't work, we'll try something else. And she was just always that one that was taking a chance on me. And it worked. It worked. We ended up running an incredible critical care course in Center City, Philadelphia, that people came from all over to attend. That's how I got into national speaking. That's why I got elected to the board of AACN, no doubt about it, because I had been on the podium so often as a speaker in cardiovascular critical care topics that Carol enabled, that she paid for, that she took my hand and led the way. So I've always said I owe everything to Carol Hudemeyer, AACN, and my parents. That's kind of my, not in that order, but AACN taught me everything I knew about critical care, about advocacy. And then to your point, what I always try to do is then pay that forward. When I was a vice president of critical care, when I was a chief nurse, try to choose those that you can help, that you can provide meaningful recognition to get them on their path, to give them that opportunity, to give them that support to start their journey. And it's worked. I could, oh my gosh, I'm sure we know so many of the same people. I know the shifties out there have know the same people that we do. And I can point out so many of them that got their start through that introduction. Or, hey, taking them under their wing, join this association. Or, hey, co-write this article with me or this book chapter with me. Bringing them along and paying it forward in that way so that then they're going to leave that legacy and bring them forward. So I see a huge trajectory there, Andrea, between individual accomplishment and as leaders, how we bring others along with us and then keep paying that forward.
And I don't want to skip all your shifts, but I do have a question. So here's another interesting thing that's interesting. My chief nursing officer, Dr. Marilyn Schaffner, we just had lunch 3 weeks ago. She was a great mentor. She took a leap of faith on my leadership. And I became the Professional Excellence and Magnet Program Director when she was the chief nurse because she saw something in me and she truly took a leap of faith. And then when I became the Professional Excellence Director of Magnet at the organization I worked at, there's so many people that I also paid it forward. Sarah Werner, Jesse Davis, like just incredible leaders that you just take under your wing and you keep them involved, you keep them interested, and you keep them inspired. And I think we owe that to our profession, but not only to our profession, but we owe that to society because I believe nurses rule the world. I believe nurses make the impossible possible.
Yes.
And I believe that there should be a nurse in every industry period, the end. So, all of your involvement with AACN and being a chief nurse, what was the in-between in Hillrom. I heard Hillrom in there. I was the
Mhm.
first chief advisor for CeraVe Skincare,
Yeah,
which
yeah.
again, I walked my little Missy self in there and told them exactly why they need a nurse advocating for nurses. Um, how did you get to the role you're in now? Were there a couple steps in between?
Yeah, there was always a few steps. Some of it involved when I relocated to North Carolina and then different transitions. I did a few startups. Just, I think the secret there is just always raising your hand because there
Right.
are opportunities out there that we can't imagine that we would have never envisioned. I mean, if you had asked me 48 years ago, did I think my career would have taken the path that it did? I was like, what? Are you crazy? No, I no. And then one thing leads to another. And sometimes uh, I remember taking a role because I didn't want anybody else to get it. That was my first management job. Like, no, I'm not going to be a nurse manager. I want to take care of patients. Wow, but you know what we needed, and they knew I would advocate for them, and it turned out fine. But yeah, so you just raise your hand and keep putting yourself in the position for opportunity to present itself. And a huge part of that though is, I mean, I'm a great person with networking. You mentioned Bonnie and Mark Barnes. They're two of my dearest friends. I've been working with them, supporting the Daisy Foundation for over 20, I think it's got to be over 20 years by now. But just we stay connected. We're on opposite sides of the country, and we make sure we do monthly Sunday afternoon phone calls together, and most of it's girlfriend to girlfriend, and a lot of it's profession, obviously about nursing and advocacy. But at the same time, I'm still in touch with people from my first jobs, from my roles, from my association work. And I think that's how you just kind of keep each other in mind. And then who knew I'm president of Kirby Bates Associates right now. We are an executive search firm. We connect the dots all over the country. We're placing leaders in every C-suite role in healthcare. And you can't imagine how many times I know somebody who would be great in that role. Or let me make a few phone calls. And I have a team of experts who do that all day long. And the connections we make stand the test of time. And Andrea, it comes back to what you said. I also believe we've got to have a nurse in every setting, in every role, in every industry, because our community depends on that. Who are the best advocates? It's nurses. And we see that play out time and time again, and the difference that we make, whatever the role, whatever the title, whatever the organization, every role matters. And nurses' voices are just so impactful and have to be elevated and amplified.
I love it. I love it. So I'm taking notes because at the end of every episode, we leave shifties with a couple of nuggets or a couple of words of wisdom. So I have a couple notes because you've said two things that I love so far, and I think they're instrumental in professional growth. So my next question is, let's talk a little bit about the Daisy Foundation and the impact and the shift that it's had on you personally, and then how has Kirby Bates and Associates partnered with Daisy, and what's been that impact?
So I remember the moment I learned about the Daisy Foundation, and it was from my AACN colleague and mentor, Ann Evans, who was a past president of AACN. She was on the board of the Daisy Foundation at the time when I got my role at Hillrom, which was probably 25 years ago. And Ann Evans, thinking of me in my big industry role, oh, you must have a lot of money. Get involved with Daisy. You can get a lot of money for Daisy. Ann said to me, you've got to meet Bonnie and Mark Barnes. I'm going to introduce you. You got to know these people. They have dedicated their lives to elevating nursing and providing meaningful recognition for nurses. So Ann Evans facilitated the introduction of me to Bonnie and Mark Barnes. We just started talking about different ways that we could collaborate. I was in an industry role where we had resources. And next thing you know, we ended up creating so many avenues to celebrate and recognize nursing. We worked with the National Patient Safety Foundation to create it's still being given today, the National Patient Safety Award with
Mm-hmm.
Daisy. I'll just say I created that with Bonnie and Mark at the time. That's probably 20 years ago. And so we became fast friends as well. And we had so much in common. And the lives that we led just intersected in such a beautiful way. And I was able to carry Daisy with me everywhere I went. So every national keynote address that I gave, I had my Daisy pin on. Every time we were in a booth, whether it was with Hillrom or in other roles, certainly now with Kirby Bates, we brought Daisy with us. Every introduction that we could make to bring Daisy forward. Every place I went, are you Daisy? Are you part of the Daisy Foundation? Or I would go into a hospital and see all the Daisy information in the foyer and the Daisy pamphlet. So, just trying to bring Daisy everywhere I went. Certainly when I got to Kirby Bates Associates 6 years ago, we had the opportunity to really just amplify that partnership even more. And of course, Daisy has grown so much over these last decades, so many partners, so many just great relationships that are helping to elevate nursing. Well, we've stayed right in there. Kirby Bates has been a huge supporter of Daisy all this time. And one of the best ways that we celebrate with them is a big event that we do every year at the AONL conference, which is coming up in a few weeks in Boston. Kirby Bates sponsors the Daisy Breakfast at AONL. And my director of marketing, Lori Anderson, works so collaboratively with the Daisy team, Tina and Melissa, everybody at Daisy. And we'll have probably 200 people at 6 o'clock in the morning that Wednesday in Boston. And they'll be lined up out the corridor to get into this breakfast. And we use that opportunity to amplify a story, sometimes a few stories of Daisy Award winners, leaders who have facilitated meaningful recognition. And it's just the highlight. It's just the highlight of the year for me. And we do that in great collaboration with Bonnie and Mark, with Deb Zimmerman, of course. And then, that's our way to sort of do something beyond our sponsorship. I mean, that's the thing too. Anybody can write a check, right? We've all written checks. This is different. Yeah, we write the check, but we give ourselves. This is our core passion, is absolutely aligned with the Daisy Foundation. And we bring that to everything that we do, that recognition and celebration of the most important voice in healthcare, the biggest sector in the healthcare industry, nursing, the ones and the only ones who are with patients 24/7, nurses. So yeah, I'm really, really proud. And I just feel so blessed and grateful to have had decades with Bonnie and Mark and the whole team, and have been able to spread that word many, many, many times over and celebrate who they are and what they do. And you stop and think, and for those that maybe some of the shifties on the call don't know the whole history, but when you think about this family, the Barnes family, what they lost, what they went through when they lost Patrick, and to have dedicated their lives in the face of such devastation to make something so positive come out of that experience, and to recognize and honor nursing, I just think it's a phenomenal example of humanity that they've taken all over the world, It's quite a story. It's quite an amazing story.
It's an amazing story, and it really edifies the power of kindness, the power of gratitude, and the power of meaningful recognition. And that's why I'm so excited. SE Healthcare sponsors this podcast, and SE Healthcare believes in me to have this podcast and have great people like you, Melissa, come on and tell these stories that shift mindsets and shift people's thoughts and shift people's beliefs. And that's really the crux of the whole Shift podcast, truly. And to hear
I've listened to so many of them, Andrea, and I love them. I just have loved them. I think you've done an amazing job with that. And I love the fact that we're hearing from people who are looking through nursing and healthcare through multiple lenses. And I really think that's a strength of what you're doing. I really applaud you for that. I was thinking about this whole idea of lenses that we look through, right? And
Yeah.
somebody asked me this. I did a presentation recently, and it was about healthy work environments and how to infuse joy into leadership, right? We're so worried about the safety and well-being of our healthcare providers. And how do we assure their safety? How do we assure safe passage for the patients from one place to the next? uh, Boy, how do we stay joyful in our work? I think a big part of that is gratitude that you just mentioned. I think infusing joy and gratitude into our roles, into our workplace, that can be contagious. Let's make that contagious and let's bring everybody along with us. But I was telling a story just on Friday at NCONL out. I was kind of evaluating my career trajectory recently, and I had all these different experiences. My youngest son had open heart surgery when he was 11 years old, and man, it was 18 months after my husband had open heart surgery. There's something about an adult going through that. You're like, that's okay. But when it's your baby, when it's your child, it for me was a whole different thing. And I just remember being so mindful. Of course, I'm a critical care nurse.
Right.
You can't separate yourself from that. I'm there as the mom. It was at Duke where I was the chief nurse. I mean, I was wearing all these hats in the moment, but that's your child, that's your baby, and that's his chest cracked open, and that's the chest tube getting pulled out, all of it. And I just remember thinking about nursing from that bird's eye view of the mom holding her child's hand through that. And then I looked at it through the lens of uh, a daughter whose mom was suffering year after year with really significant Alzheimer's disease and the cruelty of that disease, and how grateful I was when we had that kindness given to my mom and the patience given to my mom under extreme circumstances. And then, I thought about this as a patient. I know, Andrew, something you and I have in common. We're both cancer survivors.
That's right.
And I'm about to be 3 years post radiation for uterine cancer.
That's right.
And I'm so grateful. But, looking at this through the lens as the recipient of care and knowing what an impact my radiation oncology nurse practitioner and my radiation oncology nurse and my radiation oncologist, that team, the impact they had on me going through 27 rounds of external radiation and 5 rounds of internal brachytherapy, which was, brutal. So yeah, I think of, I would go into the waiting room and find it was all women. Obviously, it was in the GYN Cancer Center at Duke. And I would find the most forlorn looking woman who looked like she was having the worst time of it. And I would go sit next to her and I would introduce myself. Hi, I'm Melissa. I'm a nurse and I'm going through this too. How are you doing? And I would strike up every time I went, which was 5 days a week for 6 weeks. And I would just hold somebody's hand and say, hang in there. We can do this. You're stronger than you think. Just think, if you could just hang in there, look at what's going to happen. There's going to be a new medication. There's going to be a new therapy. There's going to be a new treatment. There's something's going to happen. Just hang in there. I just try to spread joy and hope. And that's what nurses do, whether they're the patient themselves or whether they're advocating for others. That's nursing right there.
That's why we rule the world. We make the impossible possible. And, I was sharing this with you earlier, but I'd like to share it with the Shifties. And, thank you for bringing up that we have a lot to be grateful for. We are both cancer survivors, and I'll be coming up on my 2-year cancer-free mark. And my daughter was 17 or 18 at the time. Time escapes me now, but she went with me on my MRI, one of my many MRIs, and I was petrified. I'm claustrophobic. I have a cancer diagnosis. My twin brother died of cancer, so I was extra anxious.
Sure.
And to your point, there was a young lady in there, much younger than myself, who had a very poor diagnosis and prognosis. And I was, it really shook me to the core. And when I went in to get my MRI, the nurse was there, and she said, she knew me because it was at the hospital that I had worked at. She said, you look really nervous, I'm going to get you a warm blanket and I'm going to sit down with you until they take you into that MRI scanner. And I thought about gratitude, and I thought about the Daisy Foundation, and I wanted to pay it forward, and I nominated Alice for the Daisy because she was extraordinary. And
Oh,
I really want to wrap this up in saying, Melissa, that you're extraordinary. Um, all nurses are extraordinary. Mark and Bonnie, the Daisy Foundation, are extraordinary. And I'm just so thankful to be a nurse, and really even more thankful to celebrate nurses this month of the nurse.
mm-hmm.
And so thank you. I always end this, and I took a couple notes because you said a couple things that I love. Here are some takeaways for shifties. Number one, I love that you said, Melissa, raise your hand. We've got to raise our hand to be at the table and use our voice and advocate. Your words, advocate.
Mm-hmm.
I love that you said staying connected. I'm going to work on that. I stay connected, but it sounds like you do a better job at that than I do. So shifties.
I can help you. It's not easy because we're busy, but I figured out really great ways to do that, and it has paid off in spades. I will help. I will help.
So those are my two takeaways. I wrote this other one down that you said. Well, it's something, you take the Daisy with you. So I think that's really great. If taking meaningful recognition, let's make that portable. Let's make it portable. So I love that. The last thing I want to say is I'm a nurse is in the background of what I see when I'm interviewing you. And I want to say I'm a nurse, and I'm proud to walk with you, Melissa Fitzpatrick, as a nurse. So thank you.
Thank you for having me. My thing that you're looking at says, I'm a nurse. What's your superpower?
I couldn't see the rest. My eyes are old. I couldn't see the rest.
It says, I'm a nurse. What's your superpower? And I just think we are superheroes, and we need it for each other, and we need it for those that we serve. We need it for our families. And I love the idea that we're always nurses. I never want to hear somebody say, I'm a former this or a former, or just a nurse.
I'm just an ICU nurse.
No, Justa. We are ruling the world, and we're trying to do that in bigger and better ways every day. And I'm happy to be talking with you about it today.
Thank you, Melissa. And I am going to say, I'm going to invite you back. I'd love to have you back in about 6 months. Love to hear what's going on and all the change. Let me take the word change out of there. All the shifts that you've made. So I'll have you back. And at the end of every episode, I always say this, shifties, remember, your shift makes a difference. Keep shifting. During the month of May, Nurses Month, as we like to call it, is a great time to recognize all the accomplishments of nurses, and no one does it better in a meaningful way than the Daisy Foundation. Did you know that the Daisy Award honorees are eligible for many benefits that never expire, including conference grants, reduced tuition, reduced certification fees, and a discounted subscription to SC Healthcare's Nurse Burnout Prevention Program? Visit daisyfoundation.org and search for honoree benefits to learn more and see the complete list. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.